As I mentioned before, Great Britain strictly rejects a general corona vaccination requirement as it is now in Austria, for example. Getting vaccinated is a personal decision, the government said. Corona restrictions have not applied in England since mid-July. And so the picture in the British capital London is very reminiscent of the time before the pandemic. The pubs and bars are well attended, concerts and events take place without any restrictions, and you hardly ever see people wearing masks on public transport and in the shops. Anyone listening to British Prime Minister Boris Johnson these days can get the impression that everything is in perfect order in the UK. The corona data are no cause for concern, well, in Johnson's opinion. So there is no plan or a reason for plan B, which has been in the drawer for months, but is supposed to stay there. Meanwhile, the incidence is around 400, which is even higher than in Germany, where the alarm bells are sounding louder than ever before. Even the measures planned for Plan B, the introduction of which Boris Johnson does not want to think about, are anything but drastic. The plan only includes the recommendation to work from home, masks in some rooms, and vaccination or test certificates for some major events. Obligations to provide evidence, which are now discussed as a matter of course in Germany under the cryptic abbreviations 3G, 2G and 2G+, are inconceivable for many in England. There was huge opposition to such systems months ago, and the certificates were branded as discriminatory even before they were introduced. Scotland and Wales, on the other hand, who decide independently about their corona measures, have been making use of proof of vaccination for a while now. Especially abroad, the impression has crept in that the British somehow got away with their Freedom Day in mid-July, the lifting of practically all corona measures, and that the worst did not materialize. But that's only partially true. It is true that the NHS health service has not been overloaded since then, as it was last winter. At the same time, doctors are working to the limit, and the waiting lists for surgery are longer than ever. But the truth also includes the country has been counting around 1,000 deaths per week after week for weeks. The price of British freedom is to get used to these numbers. The fact that the Delta variant has driven the number of cases in Germany, Austria and other countries to previously unknown heights has not gone unnoticed on Downing Street either. Boris Johnson, who once again attracted attention with a bizarre speech, I will talk about that one in a later video, warned of the wave that is rolling over the continent and of which no one knows whether it will also wash over the English coast. That is a bit misleading, says health expert Azim Majid from Imperial College London in an interview with the German press agency. Because the fact is, for months the situation on the island has not been a bit better than in Europe, on the contrary. Since July we have never had fewer than around 30,000 cases a day, says Majid. Just recently the UK was overtaken by countries with even higher corona rates. Most recently 40,000 to 50,000 per day were counted. The biggest difference to the situation in Germany is that hardly anyone talks about it anymore. In terms of the vaccination quota, the British situation is comparable to Germany or the German situation. Almost 69% of the population are double vaccinated and the booster vaccinations are making slow progress. The effect can, however, already be seen in the age comparison. While the positive rates are rather low in the older, already boosted groups, they are highest among school children. By the way, 92% of people over 12 in my home city are vaccinated. Twice. Plan B should have been introduced a long time ago, says Majid, but the British government decided not to react preventively, but rather when it was actually too late. Fortunately, thanks to the vaccinations, hospital admissions are currently not in such a dramatic situation as last winter. The German corona expert Christian Drosten recently expressed the assumption that the situation in the United Kingdom could relax over the winter, as there are many more people who have recovered due to the heavy contamination. The Brit Majid can understand this assumption, but is more cautious. He says it can easily get out of hand again. However, the Johnson administration is not completely carefree either. In Great Britain, since last Monday, all over 40-year-olds can register for booster vaccination against the coronavirus. The second vaccination must have been at least 6 months ago. So far, only those over 50 and groups with an increased risk can book a so-called booster. Another new feature is that 16 and 17-year-olds, a total of around 200,000 people, can receive appointments for their second dose at the start of the week. And already optimism is spreading again on the island. This means that people can enjoy a safe Christmas, said the Ministry of Health in London on Sunday, and again firmly rejects the demands for the reintroduction of stricter corona rules. And as of today, we have very strict rules here in my home state, although the numbers are much better than in the UK. And from December 20th, children from the age of 5 to 11 will be vaccinated here in Germany. And I can already get my booster as soon as my 6 months are over and I'm not over 50. I'll see you in my next video. Bis gleich.